If you are a nurse who will be taking examination for NCLEX, Prometrics, HAAD, and other licensure examinations in some other countries, you might experience some anxiety and fear when it comes to drug calculations. And if you are a student who is taking up your pharmacology, this video is for you. Drug calculation made easy. Hi, blessed day to everyone. Today we will discuss intravenous and drug calculation. There are requirements for correct drug calculation. Number 1, clear understanding of the problem. Number 2, correct substitution of the values. And number 3, consistent unit of measurements. Having all these 3 elements will lead us to the correct answer to any drug calculation problems. First consideration is problem types must be understood. For the problem types, we have classified it according to drug calculation problems and IV solution calculation problems. Among the drug calculation problems that can be encountered in NCLEX, Prometrics, and other licensure examinations are the ones that has something to do with dosage per tablet, dosage per liquid, dosage per body weight, dosage per hour, that is ml per hour. And for the IV solution calculation problem, it may include problems about dosage per IV solution, infusion pump flow regulation, that is in ml per hour, and manual IV flow regulation, that is in drops per minute or in microdrops per minute. To give us some examples, example of dosage per tablet, this is calculated using the formula desired divided by available and the number of tablets. One example is given the order kalium durul 10 milligrams per orem 3 times a day is ordered for hypokalemic patient. Available is 20 milligrams per tablet, and the question is how many tablets must be given at every scheduled time. From this order, you can see the desired amount that needs to be given to the patient and the available stock, which is 20 milligrams per tablet. Another example of problem is dosage per volume. This is calculated using the formula desired divided by available multiplied by volume of diluent. It is equal to the volume of liquid required. Example of this problem, Dr. A ordered furosemide 20 milligrams, now IV for patient B. The stock available is 40 milligrams per 5 ml. How much should nurse C give? For the problem about dosage per body weight, the formula is patient's weight multiplied by the dosage per kilogram equals dosage required for a specific patient. Example, ceftriaxone 50 milligrams per kilogram was ordered for a child weighing 15.4 pounds. If our stock available is 250 milligrams in 10 ml normal saline, how much should the nurse give? Another problem is the dosage per hour. This is calculated using the formula dosage per hour divided by available multiplied by volume, that is in ml, equals the flow rate, that is in ml per hour. Example of this problem, administer nicardipine 20 milligrams in 200 ml of normal saline at 5 milligrams per hour. Set the infusion pump at what ml per hour? Now we will proceed with problems that has something to do with intravenous fluid. One example is the dosage per IV solution. This is calculated using the formula concentration percent divided by 100 multiplied by the volume in ml, that is equivalent to the dosage in grams. Example of the problem: calculate the amount of sodium chloride the patient received after finishing 1 liter of normal saline solution infusion. Second type of problem under IV calculation problems is the infusion pump regulation, that is in ml per hour. Example of the problem is, what flow rate should you regulate the IV infusion pump with the order 1 liter of D5 water to run for 10 hours? This will be solved using the formula volume in ml divided by time in hour and equivalent to flow rate, that is in ml per hour. This is most useful for patients who are in the critical care unit, as this unit oftentimes use the infusion pump for the fluid infusion. Another problem has something to do with the manual IV flow regulation. In the event that a certain unit doesn't use IV infusion pump, the nurse would have to manually regulate the IV fluid, and the measurement should be drops per minute. For these types of problem, the formula to be used is volume in ml divided by the time in minutes multiplied by the drop factor, which is usually given in a certain problem, equals the flow rate in drops per minute. Example of this problem: calculate IV flow rate for the order 1 liter of D5LR to run for 8 hours. The drop factor is 20 drops per ml. After knowing the types of the problem and the corresponding formula, the second consideration is to substitute the correct values to the formula. This is done by, number 1, analyzing the values presented in the problem, 2, recalling the formula, and 3, substituting it carefully. Example of the problem: administer nicardipine 20 milligrams in 200 ml of normal saline at 5 milligrams per hour. Set the infusion pump at what ml per hour. Okay, so from here, we should analyze the values presented in the problem and what is asked. All right, what are given? We have the 20 milligrams of nicardipine that is mixed in 200 ml of normal saline as the diluent, and the rate of infusion should be 5 milligrams per hour. Second step, we need to recall the formula. Recalling the formula, this type of problem falls on the category dosage per hour. As we are given here, the rate desired is 5 milligrams per hour, but we need to get and find how much ml per hour should be the nicardipine be infused using the infusion pump. The formula for this type of problem, dosage per hour, is dosage per hour divided by the available multiplied by the volume, that is in ml, and that is equivalent to the flow rate, ml per hour. Now, the third step is to substitute the values given to the formula carefully. So for the dosage per hour, it is 5 milligrams per hour. For the one available is 20 milligrams of nicardipine, and the volume of the diluent is 200 ml. After substituting the values carefully, we can now proceed with the calculation. Having some unit of measurement analysis will also help us justify our answer to this problem. Milligrams down in the available dosage and the milligrams there in the desired amount can be cancelled altogether, and what will be left is the ml and hour, and this will give us about 50 ml per hour. The third consideration is to ensure consistency in the unit of measurement. Many of the attempts to solve drug calculation problems fail at this consideration. So, how do we ensure the consistency of the unit of measurement? First, let us be keen and spot the difference of units of measurements in the word problem. And finally, do the necessary conversion. For the conversion in mass, we can be guided with the most common unit of measurements that is commonly used, from microgram to milligram to gram and to kilogram. So, in converting from smaller unit to the next higher unit, for example, microgram to milligram, we need to divide by 1,000 or simply move 3 decimal places to the left. Why 3 decimal places? Because 1,000 have 3 zeros, so dividing it by 1,000 will necessitate us to move 3 decimal places to the left. And when converting from higher unit of measurement to the next smaller unit of measurement, for example, kilogram to gram or gram to milligram or milligram to microgram, we need to multiply by 1,000 or simply moving 3 decimal places to the right. Let us have some example. Convert 5,000 microgram to milligram. So we are going to move 3 decimal places to the left. From the original location of the decimal place, we need to move it to the left 3 decimal places. 1, 2, 3. So the answer is 5 milligrams. That is pretty much easier. How about the next example? Convert 10 milligrams to micrograms. Our principle for converting higher unit to the next smaller unit, example milligram to microgram, is to multiply it by 1,000 or simply moving 3 decimal places to the right. So 10 having the decimal point right there, move it 1, 2, 3, and this will give you 10,000 microgram as equivalence for the 10 milligrams of the medication. Next, what about converting English to metric system? The common English unit of measurement for mass is in pounds. So for pounds to kilogram, we need to divide by 2.2. And from kilograms to pound, we need to multiply by 2.2. Converting 44 pounds to kilogram, so from pound to kilogram, we need to divide by 2.2. It will give us the answer 20 kilograms. Another thing that needs conversion is the volume. In converting volume, we should be familiar with microliter, milliliter, liter, and kiloliter. When converting from smaller unit to the next higher unit of measurement in terms of volume, we need to divide by 1,000 or simply moving the decimal places 3 times to the left. For example, convert 3,000 microliter to milliliter. The whole number 3,000, having the decimal place, the decimal point at the end, should be moved to the left 3 times. 1, 2, and 3, resulting to equivalence of 3 milliliter. And when doing the other way around, from bigger unit to the next smaller unit of measurement, you need to multiply it by 1,000 or moving 3 decimal places to the right. For example, convert 5 liters of fluid to milliliter. So move 1, 2, and 3 and add zeros it will give you 5,000 ml. Now, and when converting time, the equivalence of 1 hour is 60 minutes. So when we convert minutes to hour, we need to divide it by 60. And when converting hours to minutes, we need to multiply it by 60. For example, convert 8 hours of infusion to minutes. Convert 8 hours to minutes. So that will be 8 hours multiplied by 60, resulting to 480 minutes. Let us integrate. Now, remember that when we approach any drug calculation, there must be a clear understanding of the problem so that correct formula will be used. Number 2, correct substitution of the values. Examining what is given in the word problem, you need now to substitute the values to the given formula. And finally, have a consistent unit of measurements. Let us have an example. Problem number 1. Calculate the IV flow rate for 1,000 milliliter of D5 water IV over 8 hours. Infusion set has a drop factor of 20 drops per ml. What is the IV flow rate in drops per minute? So step number 1, we need to have the understanding of the nature of the problem. This problem has something to do with the manual IV flow regulation that requires us to calculate for drops per minute. And the formula for this type of problem is volume in ml divided by time in minutes multiplied by the drop factor equals the flow rate drops per minute. After knowing the formula, we need to substitute correctly all the values from the word problem. We have 1,000 ml as the volume divided by 8 hours as the hours of infusion and multiplied by the drop factor. The infusion set has a drop factor of 20 drops per ml. So that is the given question. How many drops per minute should we regulate the IV fluid? Now, don't forget our third consideration before you proceed with your calculation. Proceeding with your calculation without the consistency in the unit of measurement will yield error in your calculation. So the one that is not consistent here is the given 8 hours of infusion, which we need to find its equivalence in time minutes. So 8 hours multiplied by 60 minutes is equal to 480 minutes. After solving for the equivalence in minutes, we are now ready to substitute 480 minutes to its rightful place. So 1,000 ml, that is the volume of the entire fluid to be infused, divided by 480 minutes, that is the time of infusion, multiplied by the drop factor, 20 drops per ml, will give you 42 drops per minute. That is so easy, having observed the 3 requirements for drug calculation. Now, reflecting our answer to our word problem, we are asked to calculate for the flow rate in drops per minute. And our answer, having observed the correct unit of measurement analysis, is consistent with what is being asked. That makes our drug calculation answer 100% sure. Problem number 2. Your patient needs 10,000 units of heparin subcutaneous. You have on hand 5,000 units per ml. How much will you inject? Again, our first consideration is the understanding of the problem. Such kind of problem should follow the dosage per volume formula, which is desired divided by available multiplied by the volume of the diluent equals the volume of the liquid required. Second consideration is the correct substitution. From the word problem, we have 10,000 units as our desired dosage. And we have 5,000 units as the available stock. 5,000 units is diluted in 1 ml. Third consideration is the consistency in the unit of measurement. looking at all the numbers with its units, we can say that all the units from the desired to the available are all consistent. So we will proceed with the calculation. 10,000 divided by 5,000 multiplied by 1 is equivalent to 2 ml. Having the unit of measurement being cancelled allows us to analyze and give us the remaining unit to be measured. It also helps to cancel the zeros in order to simplify your calculation. So 3 zeros from the numerator and 3 zeros from the denominator will leave you with a simple question. 10 divided by 5 multiplied by 1 is 2. And the answer is 2 ml, which is consistent with what is asked by the word problem. Problem number 3. Give a 50 kilogram patient 80 milligrams of dopamine in 500 ml of D5 water to be infused at a rate of 5 microgram per kilogram per hour. Calculate the flow rate in ml per hour. Now, examining this problem, it might give you a shock having such a lot of numbers in it. The first thing that we have to do, given this problem in your NCLEX or whatever licensure examination, is just to relax and analyze one by one all the given information. Following our considerations, number 1, understand the problem. There are certain drug calculation problems that require you to facilitate a combination of formulas. For example, here, we know that there is a given body weight of the patient, 50 kilograms, and the dosage that we need to administer to this patient depends on its body weight. Another trick in this problem is we are given dosage per hour, and we need to determine how much ml per hour should we administer to this patient. This is an example of a problem that combines 2 steps or 2 formula. So first thing that we might do is find out the dosage per body weight by having the patient's weight multiplied by the dosage per kilogram, and that will give you the dosage required for a specific patient. Always observe correct substitution of the values and be consistent with our unit of measurement. Given is 50 kilograms body weight of a patient multiplied by 5 microgram per kilogram per hour, that is the dosage per kilogram. We can now cancel kilograms in the patient's weight and the dosage per kilogram, which will give us the answer of 250 microgram per hour. The next step that we need to do is to proceed with the calculation for dosage per hour. It follows the formula dosage per hour divided by available multiplied by the volume in ml, which will give us the flow rate in ml per hour. So the dosage per hour that we have calculated based on the body weight of the patient, which is 50 kilogram, is 250 microgram per hour. We need to divide it with the available dosage of dopamine, which is 80 milligrams, diluted in 500 ml of D5 water. Now, we need to go back to our third consideration to make sure that our unit of measurements are consistent. Inspecting all the units of measurement, up there we have microgram and down here we have milligram. We need to unify our unit of measurement before proceeding with the drug calculation. Otherwise, it may lead to erroneous answer. So 80 milligrams, to be converted to the next smaller unit, microgram, we need to move the decimal places 3 times to the right or multiply it by 1,000, which will give us 1, 2, and 3, 80,000 microgram as the equivalence of 80 milligrams. Substituting the new value in microgram on the denominator, which is the available or the stock dose, we have 80,000 microgram. Having observed that all the units are now consistent, we can now proceed with the drug calculation. And the answer for this is canceling microgram and microgram. The unit of measurement that is left is ml per hour, and proceeding with the drug calculation, the answer will be 1.5 ml per hour. Now, comparing our answer with what is asked in the word problem, we are tasked to answer or to calculate for the flow rate in ml per hour. And our answer is correct.